My name is Dr. Mona Misra. I am a board-certified general surgeon. Medical school was in Canada, residency in general surgery, also in Canada. And then I came to Los Angeles, Cedars-Sinai, for my fellowship training in bariatric surgery, or weight loss surgery. And I've been in practice for a little over 10 years now. The World Health Organization actually designated obesity as a disease since 1991. So we have known for a very long time that obesity is a disease and should be treated as a disease. Not only are we seeing more and more patients that are overweight or obese, probably 65% of the population is obese or overweight, but this is not a problem that's going away. We're seeing it in teenagers and children, so this is actually something that's getting worse over time. I wouldn't consider eating an addiction. I think it can be, but really, I think the problem with obesity is multifactorial. There's many reasons that people become obese, whether it's genetics, whether it's a coping mechanism, so behavioral. People eat when they're happy, sad, bored, stressed, all these reasons. It's a very social event, so it's very hard to get away from it. Socio-economic reasons that people become obese, psychological reasons. So we actually have so many complex factors that really have to be addressed to deal with the issue of obesity. So if there's behaviors that need to be changed, if it's a coping mechanism, we do actually get them to meet with our psychologists and find out different coping mechanisms that'll be better for them. If it's just the types of foods that they eat and they need better guidance on what they should be eating, they definitely are meeting with the dietitian as well, so they can get better educated on what are healthy foods, what are proper portion sizes. Body mass index, the way that we calculate it is taking someone's height and weight and then doing a calculation that creates a number. And we just use that to be able to give a reference when we're talking about weight, what exactly that means, because a gentleman that's 6'2" and 200 pounds is very different than a female who's 5 feet and 200 pounds. Anyone whose BMI is 30 to 35, that's where they're considered obese. 35 and higher with a medical problem that's related to obesity, like diabetes, high blood pressure, sleep apnea, or a BMI of 40 or higher with no medical problems, that's considered morbidly obese. So, like I had mentioned, cardiovascular disease, hypertension, diabetes, sleep apnea, cancer is even at an increased risk. So there's so many issues that people need to be aware that they're at risk of developing as their weight or BMI increases. I would say that there are good candidates and great candidates for surgery, and then there are patients who are not ready for surgery at that moment in time. And so if they're thinking that this is going to be magical and they can eat whatever they want and the surgery is just going to deal with all their problems in their life, that's not a healthy way of beginning this process. There is always a workup that's required before surgery to make sure you're safe to move ahead with surgery, but also there is usually insurance companies wanting a 3-month or 6-month failed medical weight loss or supervised medical weight loss, showing that you are unable to lose the weight with diet and exercise alone. They want you to at least attempt with diet and exercise to lose the weight. And many of these patients have done this their entire lives. They've been on a million diets. Unfortunately, most patients are unable to lose the weight and keep it off long term with only diet and exercise, which is why we move forward with surgery.